And the only thing that you can do to clear the ground a lot of times is swing that leg around the side. Okay, so that's very, very important, and that's an easy fix. Just go back to the person that made your brace and ask them if either you can have a heel lift. I prefer that they actually build the sole of the shoe up, but a heel lift will work as well. The other type of AFO that might not be great for you is one that is what we call a floor reaction AFO. So a floor reaction AFO kind of pushes your shin bones backwards. They're either blue or black. You will see like almost looks like a shin guard on the front of it. That shin guard is pushing your lower leg backwards. Now, why do a lot of people get that type of an AFO early on? Is because you're very, very weak, and maybe initially your knee was buckling a lot. And so your physical therapist in the hospital before you left thought you needed something with that shin guard on the front to kind of push your lower leg back. The downside of that is that it locks your leg out, and it's very hard to unlock your leg. And so if you can't unlock your leg, and if you think about it, it's pushing your shin bone backwards as you're trying to step forward. And so that too just makes walking extremely difficult. It serves a purpose. It does serve a purpose, that type of AFO. It's better than your knee buckling. But because of that, some people just get in the habit of swinging their leg around the side because they can't really like advance their weight forward, but then also your leg just gets locked out and you can't unlock it. So those are the two reasons. I'm not a fan of those types of AFOs if you have any type of spasticity. And the downside is that initially you probably didn't have any spasticity in your lower leg, and then usually 3 or 4 months later you start to get a lot of spasticity, and no one goes back and kind of changes that AFO for you. The other thing is that you're in an AFO that doesn't allow your ankle to bend, or it allows your ankle to point too much.